To the pandemic now, hospitalizations and ICU cases are both on the rise today, with 81 patients in hospital and 33 in intensive care. The daily case count extremely high once again. BC is reporting 513 new COVID cases, and there has been one new death. Just over 82% of British Columbians 12 and up have received their first dose. Almost 72% are now fully vaccinated. And when it comes to vaccines, a milestone policy move tonight by BC's top doctor. Bonnie Henry is making vaccines mandatory for anyone who works in long-term care homes and assisted living facilities. The Delta variant has changed the game and could lead to even more vaccine mandates. CTV's Penny Daflos explains.
A week ago, there were 3 outbreaks in BC care homes and assisted living. Now there are 11, with those residents once again isolated from loved ones.
With variants of concern, there is continuing risk for people living in long-term care, even vaccinated.
The Delta variant is driving a 4th wave of COVID in our province, which has an active caseload second only to Alberta. Unvaccinated workers are being blamed for the spike in care home infections. Nearly all seniors are vaccinated and therefore more likely to survive COVID, but Delta is different, and thus the vaccine order for staff.
Very welcome news by operators and by families of elders in care, because the anxiety around the Delta variant has been growing.
Workers must be fully vaccinated by mid-October.
I recognize that this is a change from the direction that we announced in the spring in June. We have now seen, with the transmission of the new variants, that we need extra protection in this highly risky situation.
I think it shows the flexibility that's required when you're dealing with COVID. We are learning as we go, and Dr. Henry is recognizing the Delta variant is a fierce beast.
The Ministry of Health and the Provincial Health Officer have obviously studied this question pretty carefully around the legal grounds for the action they've taken.
The Workers' Union accepts the vaccination order but warns there could be consequences in care levels.
We do have a concern that the policy change has at least the potential to compound a pretty serious staffing crisis.
The order around care home vaccinations includes mandatory reporting of vaccination status for all healthcare workers, with officials hinting
We'll be working with health authorities, with unions, and determining our path forward for all healthcare workers in British Columbia in the coming weeks.
It is not mandatory for a citizen to be vaccinated in BC, but there are things that you may not be able to do if you're not vaccinated.
And Penny joins us now with more on this. So Penny, what do we know about vaccination levels among healthcare workers, both in and outside of long-term care?
Well, that's a great question, and the answer is not very much, because government isn't sure either. It's been optional reporting of vaccine status up until now, so they should have hard numbers soon. And this all comes within a context of care home workers at the point of exhaustion after more than a year of COVID protocols and restrictions, making their jobs even harder than usual. Some of them are leaving the profession. Nurses are in a similar position, and that's having an impact on hospital care as well. I'll have more on that tomorrow, Scott.
Okay, thank you, Penny.